Assalamualaikum doctors. In this video I am discussing how can we take the history of supraventricular tachycardia in shortly as VT. So normally it comes as a two scenarios. Scenario 1 is a 15 years old teenager. She presented to the acute in emergency with racing heart few weeks ago. Missed her cardio appointment and now come to your OPD. Another scenario come like 7-month-old infant, sudden onset of pallor and restlessness over the last few hours and poor feeding. Okay. So this is the features. So how can we take the history? First of all, the main concern, any fever, awareness of heartbeat, fainting, chest pain and inability to walk. When did this start? Which symptoms started first? Is it increasing or decreasing? What did you do for that? Then associated symptoms like rigors, fits, night sweating, swollen glands, chills, shivering, these are. Generally, we ask about the fever, weight, activity and sleep. Fever or preceding any flu symptoms, activity, appetite and sleep. Then systemic 1 by 1, CVS, history of any fainting episodes, exercise intolerance, blue lips, awareness of heartbeats, blood pressure anyone measured. From chest, recent cough or cold, difficulty in breathing, noisy breathing, snoring during sleep, asthmatic, recurrent chest bugs. CNS, any headache, weakness, facial asymmetry, eye deviation, any concern about visions, hearing or speech, unusual walking pattern and change in mood. Then about urinary, change in the pee amount, color and frequency, pain in loin, pain during peeing. MSK in skin or any skin spots, muscle weakness, difficulty in climbing stairs or in getting up, swelling hands or feet and bone and joint pain. GIT, increase the tummy size, tummy pain, throwing up especially in the morning, change in poo. Hematology, pallor, bruises, bleeding and bugs. Endocrine, about the cold intolerance, blood glucose test. Other concern about dysmorphic features, long-term medical condition or chronic illness. Past history, 5TIOA, taking any medications, COVID contact, COVID vaccine to close contacts, hospital admissions, follow-up with team and recent any travel. Now about the perinatal history is that any event in pregnancy, jelly scan results, newborn screening, NICU admission. Puberty started, menstruations, is it regular, boyfriend, OCP and protection. Vaccination, about the missing any shots, allergy history. Nutrition on a special diet, type of food, amount and growth chart. Then development, loss of acquired skills. Family, about the similar condition in the family, sudden death in the family, social and psychological, school, type of school, change of school, bullying, and how about the impact of this condition. So this is how we can take the history, and our diagnosis in DD we can put like first supraventricular tachycardia SPD, we can put second myocarditis, it can be viral, excluded by no fever before, it can be pericarditis, infective endocarditis, rheumatic fever, Kawasaki according to the age in the scenario, PIMS, COVID, pneumonia, meningococcemia, sepsis, other arrhythmias like ectopic atrial tachycardia, nodal or junctional ectopic tachycardia, atrial flutter and atrial fibrillation. So this is how can we take the supraventricular tachycardia, and its chief complaints, suddenly racing heartbeat, irritable, these are. Thank you.